And Happy New Year. My name is Dawn Schubert, and I am here today from Orlando, Florida, to discuss a very important issue in women's health, and that's microvascular angina and the way it is diagnosed. There's been quite a bit of a change in the last 10 years thanks to the American Heart Association and the Go Red campaign, which happens annually in February all across the nation. And when I was in Houston, Texas, there was a lot of support for that, and Adarco and the big oil companies, Shell, Valero, a lot of them had a lot of lady engineers and other important people, so it was a big campaign out there. So now that I'm back in Orlando, I'd like to try to make it, a really good thing here also. But with that movement, which has been going on, we had our 10th anniversary last year. It has changed the way that practitioners, cardiologists, and hopefully family doctors and gynecologists approach, because sometimes gynecologists are the primary care for ladies instead of the family physician. So when ladies go for their annual well woman exam, I would like to see it standard practice for them to get a thorough cardiac executive physical workup, in addition to the mammogram and the pap smear and all those standard well woman items that they do, because more than 5 times ladies are being killed by cardiac disease and strokes versus breast cancer. And I'm not discounting that disease, but there has been tremendous work and campaigning for awareness over the last 20 years or more for that disease or health issue for women. So now there needs to be a change, I feel, in focusing on those cardiac and stroke issues, and so with the American Heart Association. So a lot of ladies can go and have a stress test, a regular treadmill stress test, and it may yield a false negative, meaning that it shows they have no problems. And there are a few things that will affect the test. Breast tissue can affect the way the EKG electrodes and equipment pick up the electrical signals from the heart muscle. Another thing is estrogen. That hormone affects, the readings also and results from the test. Lastly, it could be of the test itself, the way it's given. It may not be long enough. The duration may not be long enough. It may not stress the cardiac system enough to have shown, issues. And again, estrogen is a vital, thing in that. And then lastly is the clinician and how they are interacting with the patient and doing, participating with the patient. So those tests are deemed only 60% accurate. So because of those factors, especially and I'm speaking a lot towards women, that can happen, false positives or negatives, both can happen to men also. And that can result in, if it's a false positive, then you can get medication prescribed or have procedures that are unnecessary. But it's a good thing in a way to have a positive and then go for a more detailed test, which is the catheterization or angiogram, to actually go in and look at the arteries and the other structures that you can look at. Especially for women, the intravenous ultrasound catheterization is more accurate because, again, the plaque settles in our arteries in a different way than they do for men. And they also, the plaque collects in those microvascular structures on the outside of the heart wall more so than men. Their plaque collects in the major arteries and the main arteries. The better thing to ask for when you're getting a stress test done, if they do that, is a nuclear stress test where they inject you with a radioactive peptide or radioactive tracer, and that goes throughout, and then while you exercise, and then you get imaged afterwards to see how wide or narrow the arteries are, whether there's plaque in there, how the heart muscle is reacting to the exercise. So either that or an echo stress test, which means you're going to be put under stress on the treadmill, and then you're going to have an ultrasound done to measure the ejection fraction and other measurements in the heart muscle itself. So those two, the nuclear stress test and the echo stress test, are more accurate. They're beyond the 60%, and especially for women. The other thing that can give false readings is on the EKG is the possibility that the heart muscle has already been damaged, it's already swollen, or you may have that's called cardiomyopathy, and that can impact the test too. So ladies, if you've been told it's all in your head, the chest pain or other, things you're not feeling well, don't take no for the answer, because a lot of doctors, again, don't want to listen. They want to discount ladies' symptoms or their concerns. And go to another cardiologist or go to another family doctor, because you know your body, you're not feeling well. So please reach out. Please insist on these better tests, the echo stress test or the nuclear stress test, and or the catheterization, and ask for the intravenous ultrasound, IVUS, IVUS. IVUS is the more detailed catheterization test. It looks at the inside of the arteries in a different way too. And remember, because we collect the plaque in a different way, it's important to have that more detailed test. So ladies, I hope I've armed you with important information, and you can go out there and use it to improve your chances of getting diagnosed and prevent a possible heart attack or stroke. So thank you so much, and have a great day.